the other day. Oh, I know the other thing I wanted to talk about was Adam brought this up too. And I'm going to jump back to the things we just talked about with the talar pearl modes or the subtalar modes. The guy that came in here the other day with the real bad fractured ankle, his calcaneus was basically the only thing that wasn't broken, right? His talus was good, but his tibia wasn't so good. But he probably would benefit if you stabilize the tibia really well and just, hold the talus closely. He would probably benefit from some light subtalar joint mobilizations. I think that would be something that would help him. Because remember, he was really having a problem with gait, but that might be something to do with him, but cautiously. So that was a good point. All right, so the next thing we want to do is increase, we're going to talk about plantar flexion first, but we're really not increasing plantar flexion often in ankles. I mean, that guy with the fractured ankle, he needed everything done. So, if you take someone like a post-fracture that's healed and they're safe to do the mobilizations on, they will lack some plantar flexion, and you would have to probably do it. But we're actually going to be doing a heck of a lot more increasing dorsiflexion. That's really the thing we're after the most. So let's skip to dorsiflexion first. Let's actually do that.
Hey Dave, I have a clinical thing I just remembered.
Go ahead.
Can I share it with you?
Absolutely.
We were in South Africa last week at a conference, and there was another school there, and a couple of PTs. They were hiking the day before the conference. He jumped off a boulder, about 3 or 4 feet, landed in the sand, but under the sand there was another rock, landed on his ankle, and he said he twisted his ankle. Came to the conference and couldn't weight bear. There was a trainer with them at the conference, athletic trainer, and he said, well, I think you sprained your ankle. And so he was trying to put weight on it. He couldn't weight bear on it. It was too painful. Anyway, long story short, 2 days later, decided to go get an x-ray. He had a calcaneal fracture.
Wow.
So the Ottawa rules were at work. The fact that he couldn't weight bear.
Yeah.
And he's having surgery today.
He questioned it because I guess he said, "Are you sure that's just an ankle sprain?"
He normally puts some weight on an ankle sprain. I mean, even though it hurts, you can do it. The calcaneal fracture is a different ballgame. But anyways, they have an ORIF today.
Huh.
So anyway, I just...
Bad luck.
Was he South African? Was he South African or was he from the States?
No, from the States.
So he had to come home with that then on the
Yeah,
plane?
yeah, he was in a boot all week.
That's upside everything, right?
Yes, beautiful country.
Sorry about that conversion.
Okay, so go to page 259, okay? And this is going to be your go-to mobilization to increase dorsiflexion. It's the one. And you use this one quite a bit. A couple things I want you to note is that the lateral malleolus in this picture is facing you. Okay? The lateral malleolus is facing you. So we're going to, like, the way it's set up, that's how it goes. And then Freddie's left hand is performing some traction, okay? And his other hand's actually doing the glide. So here's, and if you also notice, Freddie's thumb is going down on the lateral side. That's another thing to kind of know. That'll help you orient yourself. But with this, and this is when it is helpful to have a little bit of a mobilization muscle. If you're skinny, you're at a disadvantage. Michael, you're not going to be so good at increasing dorsiflexion. Adam? You're good. Just teasing. But, can I borrow another, somebody have a towel like tomorrow? There we go. There. You probably didn't throw it at me.
What to say about that?
Just kidding around, right? Hey, I'm good at increasing dorsiflexion. Wonder what you're going to look like at 50. What do you think?
Probably the exact same.
Think exactly the same?
Yeah.
Nope.
Maybe a little balder.
Yeah, some gray.
It's receding lines.
Thicker glasses.
Thicker glasses. Maybe some reading.
Boy, look at them. All right, so you have your patient lying on their back. You're going to need something to fill up this space back here. They used to use a wedge, and it hurt. Actually, it was hurt. So I'd use a small towel. You know what really works well is a cuff weight or a sandbag because they're mold of the foot. But you want to have something back here. Make sure the calcaneus is clear. But something back there to hold that. Now another thing that can happen is watch the knee. See that? Sometimes that knee will pop up. You could actually put a strap. Does he have a picture of a strap in here? Yeah, he does. Okay, the old book doesn't. But you might have a strap that's here, so it stops it or counteracts that. The right hand, in this case, to this left foot, grabs the calcaneus. And what it does at the calcaneus is it provides traction. So I'm actually pulling out slightly. All right? Let's get this one over here a little bit. There you go. All right, and then, and you can actually choke up on it, and then when you come down, you'll hook onto the calcaneus quite nice. If you just grab the end of the calcaneus, you'll slip off. Okay? So choke up, lock in, nice traction. Then this hand, the thumb, comes right down. Here's the talus. Remember when you check subtalar neutral? So your web space, your hand, goes right there. Okay? Now, you can come in like this, right over top. Come in like this, but the main thing is you want to have that hand so it goes straight down. The foot would be slightly plantar flex, 10 degrees. Okay? And then a little bit of traction, and then a dorsal glide. Okay? Now if you want to increase the dorsiflexion, you just go like this, push your belly out, or use a towel. And then you can just use this as like almost like an orthotic device or a wedge there. Put them in more dorsiflexion, a little traction, straight down. You got to be careful you don't get some ulnar collateral ligament pain at your elbow, your thumb. All right, metacarpal phalangeal joint, MCP. What's the name of that condition? Gamekeeper's thumb, remember that? So, got it? You don't want to push on the tibia because the tibia doesn't help increase dorsiflexion. Right? So you want to be on the talus. Got it? Let's try that one. That one is an important one.